Wash your hands, watch your distance, and wear your mask.
Together, we have to hold the line.
Facilities. Good morning, Rodylyn. Thanks for joining us. How are you doing?
I'm good. Thank you, Thomas. Thank you for your invitation.
Yes, and so the CNMI remains in a surge. Last night, more reports of COVID-19 cases. Just wanted to update our listeners with regards to the situation in the CNMI. And so last night, the report came out. 79 additional individuals confirmed positive for COVID-19. That brings the total to 4,344 cases. Some good news, there's been recoveries, 3,887 recoveries. At the moment, 6 hospitalizations, 22 total deaths, and 435 total active cases. And the CNMI also leading the nation in terms of its vaccination rate, 98.7%. And so, Rodylyn, as the chief pharmacist and stationed there at the Kanoa Resort alternate care site, you also get a front row seat to some of the COVID therapeutics that the CNMI is able to avail of with regards to COVID-19. Can you give us an update on what's available to treat COVID-19 in the CNMI at the moment? Because we know that there's, growing use of the COVID-19 treatment pills as well. Are you able to give us a status update on treatment in the CNMI?
All right. For the COVID therapeutics in CNMI, we are pretty much, well stocked. And we have currently about 10 different kinds of therapeutics for treatment and even for pre-exposure prophylaxis for COVID. So we have Region Cove, we have BAM-ETI, we have Sotrovimab, we have Remdesivir, the oral antivirals, which are Paxlovid and Molnupiravir. We have the Evusheld, which is the pre-exposure prophylaxis. And also, we have some alternatives, Baricitinib and Sarilumab, just in case our Tocilizumab is not available in our current vendor. So,
right. And so, can you give us a breakdown on how much treatment has been administered and what our availability looks like? I know nationwide there's pretty much a shortage of everything you can think of, but what's the current situation for the CNMI? How many people have received treatment of the over 4,000 cases that we've reported, and what is available? What's left?
For Region Cove, we have, I think, for all the sites that we have, about 700 has been given for Region Cove. That's the main map that we are administering. One, because it's it's still effective for Delta, and it is being administered subcutaneously, 4 sub-Q shots.
So 700 people have received that.
Yes, about 700. Yeah.
Mm-hmm. And I know there's several other treatments in terms of because Omicron hasn't been confirmed yet in the CNMI, right?
Yeah, it's not been confirmed yet. So we have Sotrovimab, just in case that will be confirmed in CNMI. We will shift to administering Sotrovimab, which is an IV infusion, one-time IV infusion.
All right. And do you mind just breaking down in terms of treatment given through the pills, what those are, and also when that would be administered to a COVID positive person?
Yeah, it has been offered, and 2 memos were already sent to all providers so that they would know how much available oral antivirals we have for COVID, and so that they can also assess their patients and start to prescribe for it. So right now we have 80 course units of Molnupiravir, and the other one is Paxlovid. We have 40 and still awaiting for the other 60 to arrive.
And I know one thing that has always been said, and when we interviewed you a few weeks ago at the alternate care site when the federal team arrived, is that the time is of the essence when it comes to some of these treatments. So if I'm a member of the community and I test positive, what should I do? What is kind of the course of action that I should take as let's say if I test positive and I'm living on Saipan?
Yeah, they should call the COVID hotline so that they can um, be listed, and contact tracing will start processing right there.
And right now, the treatment is just available at Kanoa, or where can folks get this treatment?
In all CHCC clinics, it's all it's offered to all clinicians. So if they are able to test a patient COVID positive and assess the patient and eligible for any of these treatments, then they'll be able to order for it and be dispensed.
And is there more shipment on the way? Are we going to be getting more supplies in the coming weeks?
Yes, it's reported daily, so the allocation is also listed in the HPOP hotline, and we are we can order anytime as we need, and it's being managed by the pharmacy also.
And Rodylyn, I just did want to also get your perspective as someone who prepares this, and you hear of these cases, and especially you hear of people who need to get that treatment. We've been is it over like 12 weeks now since the surge has been persisting. What is it like at the front line? Because I know even the pharmacy that was set up at Kanoa Resort is fairly new. It wasn't there before, right? Mm-hmm. So what is the front line looking at like right now?
Yeah, it's an additional task, but it's something that is needed, and it's good that we can all help each other to cover what is needs to be done. So basically, here in Kanoa, I'm doing my job in the hospital as well. So it's like I transferred my office here basically, so I can help in coordination of any pharmaceutical needs here in Kanoa as well, while doing my hospital job.
And how have things changed? Given you've been there from the start. How have things changed in terms of the COVID response? Now we have all of these therapeutics, and the vaccination rate is really high. What do you attribute that to?
It's all for the planning and for the implementation and all the stakeholders that are helping the success of this COVID task force. I also, of course, for our leadership, for our CEO, Esther Munya, for our planning chief, Halina Palacios, and also Warren de la Gomez, and everyone else, all the healthcare professionals, CMO, John Tudela, and even those who are helping out with testings all around the island, and giving out boosters and even vaccination. So it's all going, putting all those together makes up the success of this healthcare system.
All right, Rodylyn, that's all the questions I had. Is there anything else you want to add? Your message to the community as the surge continues in the CNMI?
Yeah, so right now, we heard that, of course, with the these free testing kits that President Biden has, provided, ordering from covidtest.gov. So people now have access to COVID testing home kits, but they have to make sure that they will still continue to, report if ever they get tested positive, so they can get help. They can be assessed if they would need COVID treatments, or even or anything that would help them to get better, and the progression of mild to moderate symptoms would not end up in hospitalization or even death. That's why we are here. Yeah.
Thank you so much, Rodylyn. Appreciate your work, and you're talking to us from the alternate care site, which is where some of the patients are as well. So appreciate your work, and thank you so much for your time.
Thank you.
All right. We just heard from the chief pharmacist over in the CNMI, Rodylyn Bacani, who provided us an update on all of the treatment that they're having there, and further emphasizing still the need to go back to the basics and continue to test. But the CNMI does have an extremely high vaccination rate, almost nearing 100%. So.
Wow. Thank you, Tomas.
So CNMI, Palau, like almost completely full as far as vaccination.
98.7% in the CNMI, and
for comparison, I believe Guam we're just short of 93 now.
Oh. Yeah, well, everyone got really scared and concerned after basically 2 years of no COVID cases, in the community, and then the huge spike that was just just a few months ago. So, while cases climb, the vaccination rate also climbing.
Well,
So
fear sometimes can be an effective motivator.
Yeah, it's not working this time though, because I feel like we're kind of staying the same. But it is, if they were trying to use fear, they should never come out and said it's mild or that we're prepared for it.
Well, I saw an interesting report too, or just comments. Mild to what? It's mild to hospitalization,
right? Yeah,
or unfortunately mild to death. And so the word mild, or wherever, again, if you use the word middle, the left and right always changes. So the middle can also become extreme.
Yep. And I just say it's hard to reconcile mild in your mind when we are still seeing these COVID-19 related fatalities.
Yeah, and it never gets easier, and just in our culture too. I mean, just thinking about these cases, you can't just look at them as numbers.
Yeah. So. Thank you, Tomas.
Thank you, Chris.
9:53. Let's take a break, and we'll come back and close the show out with Cover Me. How's that sound?
Very compelling.
You guys. Yeah. It's 9:53. We're back now.